Some say it's high risk to travel long distance during pregnancy. Is that true, La?
Now, traveling and pregnancy has been an issue. It's coming up now and then. And now because of modern improved technology, that mode of travel has become more smooth nowadays. So the roads are better. But despite that, as a gynecologist, I always tell my patient that your need to travel, why you want to travel, the reason you need to travel versus how precious is your pregnancy. It has to be put on a balance. Like somebody selling vegetable in the vegetable market, you put the weight and the vegetable, you weigh. Then we pay the price and we don't complain because it is weight, isn't it?
Yes,
Fair. So if the reason is good enough, that reason of travel is good enough to overweigh your pregnancy, you may travel. But if the pregnancy is very important, you conceive after many years of marriage, or this is the only pregnancy, or is the pregnancy with IVF, or you are building your whole future in your pregnancy. Traveling should not be taken in the first place.
Yes, and especially during the first trimester.
Now, if you actually can't put this travel off, now when it is safe to travel comes the second. We say that if by nature, all pregnancies are prone for miscarriage in the first 3 months. On top of that, if you add your travel, you might increase it. So there's a more risk of miscarriage in the first 3 months. So we say that if you need to really travel, maybe the first 3 months should not travel. The last 3 months, your baby should come on after completion of the time. It should not come early out of the womb, preterm delivery. If the baby comes out preterm delivery, the baby's bodies are in the process of developing into growing. The stomach cannot digest the milk properly. Liver cannot detoxify the body. Kidney is not filtering nicely. All are immature. You take that immature out, and there are a lot of complications with preterm delivery. So we advise women don't travel in the first 3 months because of risk of miscarriage. Last 3 months avoid it because of preterm delivery. Relatively, it may be safer in the middle 3 months. This is what we give. But if they really need to travel, now if you travel on a smooth road, your speed should not be more than 40 kilometers per hour, where there's a fair good chance of well control of the speed. They should not be. They should avoid sudden pressure on the tummy. Otherwise, it will cause rupture of the water bag versus injury. And when they travel in the air, every 2 hours they are supposed to stand up and walk on the aisles and drink a lot of fluid to prevent dehydration, because once they sit in pregnancy, when you travel long duration, sitting more than 2 hours, the blood gets jammed in your lower leg and you suffer from clot. So the prevention is walk, move, pump the blood, drink a lot of fluid, so hydration is optimum. Yes. And then don't go on the bumpy roads, no? So this is very dangerous, yes. It may be better to walk.
Do we have any plans for water birth?
Water birth is something, should I put it, luxury of birth. During my training in New Zealand, when I was doing my course for fetal medicine, I attended water birth. It's a big tub in the middle of the room, and with sterile gum boots and all this, and the woman deliver in the water. And it is a choice for the woman. As soon as the baby is born, we have to be, the people conducting this has to be trained, so that the baby doesn't actually after birth drink back the water. So water birth is, it has been a fashion in the past, even in the West. Nowadays is not promoted from the government institutions. It is promoted from the private practitioners who do private hospitals. They will try many different ways in a better way to get income. So it's a good option. But here in our setting, our new mother and child hospital is coming up. We haven't put the infrastructure for water birth, not yet, but we have kept provisions of delivering in the, we call it labor room in the sky. We have kept with the good view of the city. On the top floor, 2 labor rooms has been planned in the upcoming hospital, which is separate. Women have to pay to use that. Okay, it will have a 360-degree of the Thimphu city view.
Wow.
And there will be a free position. So it may be an option that if really there are a lot of clients, we can put a big tub in the middle of the room. It's no big deal.
Yes.
And delivering, the delivering means when the woman is actually having pain, instead of epidural, a woman sit in the water. So the water gives her the confused sensation to her brain, so that it disturbs her brain sensation from the pain. So she feels little comfortable.
What else are we expecting from the new mother and child hospital?
The most important thing is that the woman-friendly flow.
Yes.
Like just now, if you are coming to the hospital, the government hospital so far has been built as a service delivery point. Okay. It has never looked into, you are so tired and hot sun coming, once you enter the hospital you need a chair to sit down, somebody to show you know that you have to, just now you have to ask people where is the lab, where is the ultrasound, where is the x-ray, where is the bathing room. So women friendly center means you come to a point and then you are control of the environment. You will see everything around you. So this is something that we looked into. Each floor has been designed such that just now the operation theater is down, mother is kept up, like that. So it has to be on the same level. You need an operation, just push, you are there. You need a baby, same in the same floor. Neonate has to be in the same floor. The delivery has to be in the same floor. Mother's room has to be in the same floor. We have incorporated at every level of the patient's comfort, physical comfort. Now there is one missing equation which will be filled. This will be the human resource. In the private, as you enter, there will be somebody with a tray with a cool juice, with a smile welcoming you. This is the human, this is the commercial factor. This is called customer care service, which is not built into the government institution yet, but we will try to put in our new, so that women feel that they are being welcomed when they come to the new hospital, because that's a gift from our queen to the women of Bhutan. That will be the top end super specialty for the obstetrics and gynecology. The foundation is almost complete. Yes. It has 2 components. The first component already is done. That's the outpatient department. Then the pediatric and the gynae ward. The foundation is almost complete now. It's coming up.
Why are we not revealing the gender of our babies before birth?
I have seen in the past that you must also have heard people going across the border to Jaigang, and you must also heard about female infanticide, female feticide in India.
Yes, sir.
Now in India, if you reveal gender, it is punishable by law. There is no bail. You go to jail, you lose your license. So there is a lot of social factor built into having a son priority in India. So because of that, and also I have seen that from our side also, people do cross the border, but detail I do not know. But that is one presumed risk factor. But I know that Bhutanese will not do that. But there may be, anything is never 100%. If they know it, if you have 3 daughters, and you are with the 4th, somebody might walk. If you have 5 sons and you are going for the 6th son, somebody might. Once, because you open the possibility door. So keep it shut. That's one point of view. But the better reason is 2 parents, father and the mother, they have a predetermined aspiration to have some somebody in their life. One may want a son because if you have a son, somebody had a son, this son has done this is some stereotyped imagination of a castle building is already there. And in the other is the other gender. If I have a girl, if I have a girl, this will grow up into like this lady and who has done like this. Again, a stereotyped aspiration is built. Now, if I tell in the middle, you are carrying this, one of them is going to definitely be unhappy.
Yes.
Okay. This unhappiness will be rotating at the subconscious level. Oh, I wanted this, anyway this. So the person will be telling her, okay, now anyway, I wanted this, but I have to accept. Okay, over and over. Discrimination before birth. We have grandmothers, we have aunties, we have uncles. Whole family will not agree to have either a son or daughter. Okay, all divided. And there is discrimination before birth, even amongst other relatives, not only the father and mother. So they know that, we wanted this, but anyway, this is coming. Okay, what to do? But we have to accept. Like this type of feeling comes in, no? Whereas in the West is different. Whereas in the West, the father and mother are working. They have no time. Okay, they really want things in the right direction. They want the rooms to be fixed. They even get the names so that they are pre-planned, because only two are there, no? Husband and wife, and they take leave from their working to have children so that they can have everything in the. But in our context is all different, all different. So in that context, if the mother and the parents, they know that the sex of the baby at birth, everybody says that, he has a childbirth. Then the next question comes, what is the child? Then they see this is a girl, this is a boy. Then they see that, cute. Their subconscious level mind has no time to, I wanted a girl, but then now it's a boy, now I don't like. No, you like it because it's moving, making sound, it's there moving, no?
Yes,
so you get a bigger, faster connection with the baby, the liking. There's no discrimination. This is the point that I personally favor. That unless the baby has some genetic problem, until today, maybe now there may be people who do not agree with me, but I still feel that this is a good practice. But you have to make sure the baby is not sick, baby is not deformed. That is more important.
yes.
If your baby is healthy, let it declare its own gender at birth. And the mother also feels happy because she has been controlling over the baby, isn't it? She has full control of her pregnancy. She didn't know what it was, and it declared itself, isn't it? Nobody to blame. But if somebody tells this is a boy and girl, then everybody will be sending on Facebook, I'm pregnant, having a girl, and somebody will say, boring, you should have a boy. Possible. Huh? So these things, looking at these things, I think I still prefer, if somebody asks me, I will say keep it. I make sure that your baby is healthy, and you should be worried about that, not the gender, because you can't change it. But instead there's a risk of somebody developing discrimination before birth. And on the other side, better reason, that there's another reason that we as a healthcare provider are supposed to use technology in a very useful manner, that once you use the technology, it has to deliver something useful. Suppose we use the phone. I communicate with my family. I need the phone. Otherwise, with it, I cannot. Now we use ultrasound to look at the baby, whether baby is deformed, baby is sick, or all this way. But if you use the ultrasound only to look for the image of the face, this is called 3D, 4D. You can see like a photograph, isn't it? This is misuse of technology. If I use the ultrasound to look at the gender, after looking at the gender, I can't change the gender, isn't it? So it doesn't fulfill the requirement of the use of technology to change something into better. So I should not be using ultrasound to tell gender, because it's useless. Because anyway, without ultrasound, gender will be there. It will not change. So that is the using technology in a useful fashion, no? to help better outcome of health.
If I'm coming for delivery to the hospital, is it okay just to bring my husband, or do I need my mother or someone else too? Because there are women who think, oh, just my husband is enough. But I'm one of those, I feel like I need my mom, my sister, and my best friend for delivery. What is your recommendation?
What we actually tell is, you should bring the person who you feel the most comfortable. It may be your mother, it may be, but there is one concept we globally we are promoting is the partner participation in pregnancy. From day one of pregnancy, at each visit, the partner should be taking the wife hand in hand for all the visits of pregnancy, checkups and questions, and they should ask the questions together to the doctors, and they should plan all together. So partner definitely, because we want the father to be responsible and to be around because that's the biggest support the wife has. And then besides the partner, it depends on you now who you want to bring, the most comfortable. We don't want you to bring many people, because many people bring many bugs also. It can cause infection. So we allow here, but till date, because it has been a tradition that women are delivering and put on the table, a very uncomfortable table for the woman, very comfortable for the doctor and the nurse to conduct. It is time that we need to now change the delivery position, because so the delivery position in elsewhere is a woman to choose, and we are there to assist. But here it is, time has come that we need to look into that. We don't want the woman to be tied up on the table, very uncomfortable. She has never stayed on the table like before. But in the rural context, I have seen that they use a rope hanging from the ceiling or a scarf or something. They hang on that and deliver. That's a tradition way. But we need to modify. We need to bring the traditional into hospital. So we can create, in the new hospital, we have a room called home delivery in hospital. You can take any people you want inside, like your home. You deliver. You don't call the doctor unless you really need help. But if you need, you just open, we are there. This is a home delivery concept in hospital. Free style, free people around you, at your will, and like at home. But on the others, we want also to little bit modify so that they can deliver on the floor or catching a rope. We want to promote in future. That is very much there. So bringing the person to hospital, yes, definitely we want the husband. Besides the husband, whoever you are comfortable, you can bring, yes.
But currently we're only allowed 2 people, Mola.
Yes. We say 2, but they bring 2, 3 also. So we understand the situation because it is an emergency for the family. So I always say that yes, we welcome, but at the same time, don't crowd. Somebody can stay a little far away, and somebody can rotate and shift. No, we want people to give mental support.
But definitely, you should bring more than your husband, right? Like
Yes, more than one. Okay. Because somebody is there to catch your hand. You are very painful. Somebody to little bit move around, give you things to drink and eat. So definitely more than one.